Yeah.
Sure.
Hi friends, so good evening again from Richardsons Face Hospitals. I'm currently at Bangalore, but we have two setups, one in Tamil Nadu in Nagercoil and the other at Bangalore in Karnataka, both in India. Now, I am going to start off with some of the queries that our patients have asked us with relation to facelift surgery. And then if I get more queries, then I'm going to answer on those queries as well. So what is a facelift surgery? Very, very basic thing. Facelift. So it's basically to lift the face in order to get the creases, the jowl and the tiredness go away. So we generally do facelift from around the ear, and so we lift the face. That's called a facelift. So when was this facelift done really? A little bit of the historical background. The first facelift was done probably 100 years ago, but only in the 70s and the 90s, really more and more work was done on this type of cosmetic surgery, wherein patient could be made to look younger, especially people who are moving on to their 5th, 6th, 7th, 8th decades of life. Alright, now so what is in short about this facelift? So what we do is we make a cut from this area, go around the ear, go around the lobule on the back of the ear into the hairline. Then a flap is raised underneath over the bone and the muscles all the way up to the midline and as much as needed. There are different types of facelifts depending on what amount of surgery is done. Is it a mini facelift, a superficial facelift, a subsmash facelift, a lateral facelift, a deep plate? Many types and nomenclatures are there within the facelifts, like in any other procedure. But what you have to basically understand, it's done to tighten, to pull this mass or the layer of the muscle under the skin and also the skin. So who's a good candidate for facelift? Because I have patients who are coming in the age of 25 and 30 who are now asking for facelift because they think that they have some loose tissue here. No, they don't need facelift. If you're in that age group and have some double chin here or loose submental chin, you need what is called as a genioplasty, mentoplasty, some form of chin augmentation with submental liposuction and not a facelift. So a facelift is done for a person who's typically in the age group of about 50, 60 or 70, is loose skin also, and then you can address the entire area, especially the jawline, the area of the cheek, the cheekbone, beneath that, little bit of tightening around the nose and also on the neck. Alright, so this is the surgery that is done from outside. So is there going to be scars? Yes. They're going to be very fine scars because we use techniques to minimize the visibility of these scars, but still it's not scar free. A fine scar which is actually inconspicuous or which is not visible will be there, and so that is one of the things that you have to take care when you consider your facelift surgery. Now, can this facelift be combined with other surgeries? Absolutely. So we here at Richardsons combine this facelift with, for example, rhinoplasty. You can combine this with some middle third lift or a blepharoplasty, it's a mid-face lift with different names. You could do an upper blepharoplasty, forehead lifts can be done. Also some work on the chin can be done, submental region can be done. So when you add all of these procedures, I tend to call them as a face makeover. But yes, we can add in other procedures to this kind of face book. So Sagar, hello, and Tangerine, hi from the Philippines, and yes, it's nice to have you all back. And I thought I had a few queries on this topic of facelift that I have not addressed, I think for a long time. I'm going to start with that. What are the complications of facelift? Now, if it's not done well, you can damage the nerves of the face, but it's very, very rare if you're a good surgeon and actually know the anatomy and the plane of dissection that you're doing these procedures. Apart from that, you can have hematoma, collection of blood, And asymmetry is something that a very few percentage of my patients also get. That is, one side looks a little bit tighter than the other, and so that could be something. The earlobe can get pulled a bit, so called like pixie ears. But even if it doesn't get pulled a lot, that could be a complication. Hypertrophic scars that are thick and not so nice. So these are all the various complications that you could have apart from bleeding and infection, which is pretty much common for every surgery that we're doing. So, Sayan, you want to know about facial growth? Okay, so that's getting into the different pediatric age group. I'm going to try and finish what I have to say with regards to facelift, because this has been something that a lot of our patients have been asking the last few weeks. Even the last time I wanted to answer some of these queries, but I did on the different types of jaw surgeries and rhinoplasty. So nose surgery के बाद scars नहीं दिखते हैं. यहाँ पे कट करते हैं छोटा सा ओपन स्ट्रक्चर राइनोप्लास्टी के लिए, फिर भी आपको स्कार्स दिखेंगे नहीं. तो फेसलिफ्ट पे चलते हैं. मैं आपको और ज़्यादा चीज़ बताता हूँ. फेसलिफ्ट में अगर आपको फेसलिफ्ट कराने हो तो हमारे हॉस्पिटल में आपको 1 हफ्ता रहना उचित होगा. क्यों 1 हफ्ता? क्योंकि 1 हफ्ते के बाद स्टिचेस खोल दिए जाएंगे, और अगर तब तक आप हमारे पास रहोगे तो आपके लिए बेटर है. पर अगर आप जाना चाहोगे, ये भी पॉसिबल है. फेसलिफ्ट के बाद क्या कोई डाइट रिस्ट्रिक्शन होता है? बिल्कुल नहीं जी. फेसलिफ्ट बाहर से किया जाता है. आफ्टर 5-6 आवर्स आपको नॉर्मल डाइट दी जाएगी. डाइट रेस्ट्रिक्शन इज नॉट देयर विद फेसलिफ्ट. अगर आप फेसलिफ्ट के साथ कंबाइन करोगे विद सर्जरीज, फिर हाँ हो सकता है आपको डाइट रेस्ट्रिक्शंस. तो आप यहाँ पूछ रहे हैं बोन ग्राफ्ट और राइनोप्लास्टी का कॉस्टिंग के लिए आप हमारे पिक्चर पोस्ट करो, व्हाट्सएप के नंबर में मैसेज कीजिए और हम आपको बता देंगे कि इसका टोटल कॉस्टिंग आपको कितना होगा. और राइट साइड का फेस थोड़ा बिगर है, तो इसको बोलते हैं फेशियल एसिमेट्री. तो ये फेशियल एसिमेट्री बोन की वजह से हो सकता है, मसल की वजह से हो सकता है. तो इसको हम सही कर सकते हैं डिपेंडिंग ऑन वेयर द प्रॉब्लम इज. उसको हम डेफिनेटली सही कर सकते हैं. तो एक लास्ट थिंग अबाउट फेसलिफ्ट I also something called as reverse facelift. ये reverse facelift क्या है? जब आप genioplasty कराओगे, when you do a genioplasty or mentoplasty and tighten the entire jawline and the face by pulling it forwards and downwards, I tend to call that as a reverse facelift. So reverse facelift is a bony work, less of soft tissue work. Facelift is more of a soft tissue procedure. Are there any adjuncts we do here with facelift? Yes. तो facelift के साथ कभी कभार फैट हार्वेस्ट कर लेते हैं और ये फैट को मालार रीजन में फिल करते हैं. तो इसको बोलते हैं डिफरेंट टेक्नोलॉजी, फिल एंड फेस लिफ्ट या ऑगमेंटेशन फेस लिफ्ट. जो भी है, जो भी वॉल्यूम जो आपके स्किन में कम हुआ है, इसके वजह से रिंकलिंग और लूज इलास्टिक स्किन डेवलप हुआ है, तो इसको टाइटन करने के बाद फैट ऑगमेंटेशन भी की जा सकती है. इसका भी आपको बेनिफिट होगा. सेकी सर्जरी में की जाएगी. सो आई थिंक द ओवरऑल आइडिया अबाउट फेसलिफ्ट. इफ यू हैव एनी मोर क्वेरीज, you can send in your pictures, because then we'll have an idea about what type of facelift is best for you. Do you need a mini facelift, or do I have to go in and do a deep plain facelift, or just going to be a lateral mass facelift? So depending on the seriousness, the amount of improvement that you need, sometimes we also combine this with other types of jaw procedures, like I just mentioned, jaw sculpting and genioplasty, and nose, for instance, or blepharoplastics. So I think the objective of this becoming live was to explain a little bit about facelifts, and also answer the queries that I had written down, which our followers and subscribers have asked. I've answered all of them. So quickly, I'm going to get down to some of the questions you asked me right now before I say bye for today. So Saloni, hi, you asked me about droopy eyes solution. So droopy eyes can be solved with oculoplastic or eyelid surgery, blepharoplasty or the variant of it. Send us your pictures, we'll let you know. Usually day care होता है, आप सवेरे आओगे शाम को निकल जाओगे. रिकवरी फटाफट होता है. 6 days के बाद 7 days के बाद you can remove the stitches as well. तो अक्षय वेरी सॉरी दिल्ली नहीं आता हूँ सर्जरीज के लिए, लेकिन आप यहाँ आ सकते हो, आप वेलकम हो. बहुत पास में है हमारे हॉस्पिटल, बैंगलोर इंटरनेशनल एयरपोर्ट से सिर्फ 20-25 मिनट का रास्ता है. इसके लिए हम बैंगलोर में आए हैं ताकि आप दिल्ली से, मुंबई से, जहाँ पे भी हो, दुबई से यहाँ आना ईजी हो जाएगा. और हमारे तमिलनाडु सेंटर केरल के पास में है, ट्रिवेंड्रम आना पड़ेगा आपको अगर आपको नागरकोइल पहुँचना है. Yes, Kritipati, we can give you the estimate. You please send us your details on our WhatsApp. This we are doing on a regular basis. So we are having 4 to 5 different numbers, 4 to 5 different members, and also different doctors on these numbers. We're going to give you 24/7 replies. हाँ जी, sometimes it gets delayed. माफ कर देना, but we will reply. And once you get reply from us, clarify all your doubts, take appointments, get confirmation for surgery, and then travel down to our hospital and get it done. Yes, Akshay, DNS does come under insurance, so you should be able to get reimbursements for any septoplasty that is done because of a DNS, or even a septorhinoplasty where the main reason is functional. Yes, absolutely. Alright, so thank you. I hope this short live video was useful. अगर आपको और भी डाउट्स हैं फेसलिफ्ट्स के बारे में या कुछ भी और डाउट्स हैं फेशियल सर्जरीज के बारे में, तो आप हमें टेक्स्ट मैसेज करिए व्हाट्सएप नंबर में, हम आपको उत्तर देंगे. एंड देन हैव अ नाइस डे, बाय बाय, एंड अ नाइस वीकेंड टू. थैंक यू.